Donc merci d'être là. Je suis Jean-François je dirige Carte Blanche Partenaires. Je vais juste être celui qui gère aussi un peu le temps et le passage de parole et une légère intervention. Nous avons le plaisir d'accueillir le docteur Vikram CHHATWAL, qui est le président du TPA majeur en Inde et qui va donc nous présenter ce que c'est qu'un TPA de façon complète. Derrière, je ferai une petite intervention. Nous continuerons par Roland Pétu qui va vous présenter une nouvelle manière de faire de la prévention du dépistage dentaire. Et nous finirons par maître Cécile Vermudaki qui nous présentera un peu l'état de l'art du droit dans tout ce qui est gestion de données de santé. Je vous propose d'attendre la fin des interventions pour poser vos questions, si vous en avez. Le timing est prévu pour, donc normalement il n'y aura pas de souci, vous aurez un temps de questions-réponses si vous le souhaitez. Et puis je passe la parole directement à Vikram.
Thank you and good morning. Pleasure to be here with all of you in Paris. I know it's a lovely sunny day outside, and I'm sorry I don't speak very well in French, so you'd pardon me to allow me to speak to you in English. It's a great honor to come and spend a morning with you and talk about the Indian healthcare system. I run a third-party administrator called MEDI ASSIST, and I would love to take you through a little bit of the Indian story. So I'm just going to... Now I'm stuck here because I remember this in English. No, not a problem at all. So, you know, the Indian market is just about coming alive. We have various modalities of insurance that are being tested and tried, and as a result of which we have about the market growing at 30% year on year. And I think that this growth will continue over the coming foreseeable future. People have traditionally never had any form of health insurance or cover. The government has not been a participant in providing free or affordable healthcare to its citizens. While it was always part of the plan, the government did not have the funds to be able to allow people to gain access to healthcare. So at this point in time, we see a resurgence in both the government participating in provision of healthcare and the private sector taking off in being able to cover their employees under a plan. And I think that the reason I tell you about that is the fact that one of the big drivers for increased adoption of health insurance in India would be the ease of use. How simple can you make the access to healthcare services? We are 1.3 billion people spread over a very large geography, and as a result of which, if we don't actually solve for ease of use, we're never going to be able to serve the communities that we're working in. This is a little confusing, but I call it the Great Indian Market. All it's trying to do is to show you that if I look at a pyramid, there are individuals and companies who can afford health insurance, and about companies that are larger than $15 million in turnover, about 70% of them already cover all their employees. Individuals who earn more than $1 million, about 70 to 80% of them actually cover and have health insurance. So it's important. But as you go down the pyramid, you realize that there are people who earn, or what we call below poverty, who earn less than $500 a year. And for them, gaining access to healthcare has always been a very, very difficult challenge. Today, the government has stepped in, and we today see about 400 million people covered by various state or government-sponsored schemes in India. We have another 45 million people who are employees of the government of India. So that's 45 million more. There's about 57 million people who are covered by their employer. And of course, the individual group, which is the smallest right now, about 29 million people, is individuals who actually go and buy a private health plan. So this is coming nearly to 550 million people that have insurance, cover to insurance in some form of healthcare. If you looked at this 10 years ago, this number was very, very, very small. But today, close to half the population has some form of healthcare cover. And I think that's going to keep changing. It's this rapid growth, it's this need to make sure that every citizen has some form of health cover that's changing the market in India. Just to give you a breakup, this is in US dollars. Hospitalization is about $44 billion. Outpatient services to doctors is about $5 billion. Drugs or prescription benefits or pharmacy is about $11 billion. Diagnostics, $6 billion. And of course, wellness or preventive care at about $1 billion. That's the size of, the estimated size of the Indian market. I think what you must remember is that the market is growing at 30% year on year. So these numbers look very different if you just project them out for another 3 to 4 years. It's very important to remember when you think of India as the fact that about 68% of all the spend on healthcare comes out of every individual's pocket without insurance. So out-of-pocket spend, we're a cash market, and out-of-pocket spend is very, very high in India. This number used to be like 80%, but today we see about 68% of all the expenditure is coming out of individuals' savings or pockets. And this has got to change. If this doesn't change, you're not really going to see a lot of growth in the Indian market. And then, of course, I think the last slide just on the market is to tell you that we think that the market by 2020 will be about a $60 billion market from 44, $45 billion. You'll see that really come up to $60 billion. And I think there's enough headroom, there's enough of an opportunity in the market to head in this direction. Now I come to the company that I run. We manage about 140 million lives across India. We are the largest in the country, and I have 6,000 other colleagues, 6,500 employees in the company. We grow on average at about 45 to 50% every year. That's the growth of the business that we run. So not too long ago, we'll be very small, and we're getting larger and larger. I have come here after talking with the speakers, trying to share with you how we are attempting to change the paradigm in how we administer health insurance and access into the health market in India. We set out to solve for 3 problems. How transparent can I make information to everybody in the ecosystem? How can I move from a reimbursement structure to what we call a cashless structure where you walk into a healthcare provider? And last of all, how can I make sure that the experience is complete and access to my services is available 24 hours a day? These were, simple ideas. We spent a fair bit of time over the last 5 years trying to think through, how do I make sure that information is real time? How do I make sure that information is available on every possible device and technology? And how do I make sure that when you walk into a provider, everything can be rendered cashless? I don't know how many of you realize that the most promising mobile phone market in the world is today India. We have 250 million smartphone users. We have 900 million mobile phone users. And today there is not a single mobile phone or technology company that's not looking towards India to sell their mobile phones. 15 years ago, this was not a conversation. People did not think that India would end up in a state like that. And so we went out there and said, okay, how can we change this experience? If we're going to keep to the traditional formats of administering health claims, we're going to make ourselves too expensive, we're not going to allow people to access healthcare, and it will be a failure. And so we started with the idea of building a platform of services that were technology enabled. We call it MediBuddy, a medical buddy. Today, this platform actually allows us to run pretty much all of the transactions that you would think of in the healthcare environment. We have providers who are electronically sending us structured data. We, in turn, actually manage our whole relationship with our providers and with our payers electronically, and have completely transformed the way services would get rendered as compared to 5 years ago. I will give you an example. Let's say I wanted to get admitted to a hospital for a certain procedure or type of care. I would go on to my platform on my mobile phone. I would choose the closest hospital based on what I was looking for. I would choose the service that I require. So I build patient's choice significantly. Once I choose the service, the platform tests the service against the plan benefits that I have, the insurance benefits that I have available. And if they are available, the platform will go ahead, book an appointment, book the bed, get the appointment with the doctor, and send you back, as a customer, send me back a one-time password, OTP, a single password that will come onto my mobile phone. I then walk into the hospital, give the hospital my one-time password, and I get admission straight away. I could track my claims thereafter. And of course, I could maintain medical records. If I had some part of my claim that was a reimbursement claim, I could submit the reimbursement claim. I could switch from services like pharmacy benefits. If I wanted my drugs delivered home for the month, I would switch my benefits and then go down to pharmacy and say, okay, I order my pharmacy services. And last of all, we've begun to integrate fitness solutions. So we have a fitness solution called MobiFit. It deals with walking, running, and bodybuilding. And it uses your mobile phones. You have 3 very strong sensors in your mobile phone that actually do much better than everything else. And so what we're trying to do is to build this universe that integrates every single element. If you had a wearable device, that wearable device can talk to. So if you bought a Fitbit, then the Fitbit would talk to this system. The system would pick up the data and build a world around you. I'll give you a second example. This is an example where I raise a service request in a hospital. The hospital accepts my service request, confirms the appointment, uploads all the reports and results back onto the platform. I can track my claims, and then of course there is a large analytics tool at the back end that employers can take a look at and actually run, or insurers can run these analytical tools to be able to make decisions on how they actually would want to deal with that policy going forward. Last of all, I think the core piece, as I was hearing about Carte Blanche and the work that they do here, was our belief has been that some health services deliver better when you allow beneficiaries to make choices, when you allow people to make choices. Services delivered at work or at home, or even at a medical center, and both for preventive care and for chronic disease management. Are services where we think that if you empower people to make choices, they actually are better than us at making those choices. If you leave it to the administrator, the TPA like MEDI ASSIST to make the choices, I think we do a poorer job. But if I actually gave it back to you and I empowered you to make choices, you'll do a better job. And so this is an example of saying we're going down where we want to empower individuals to choose a service, make a choice, compare and book. So they actually can now start saying, should I go here? What did the last 5 people have here? What's the chances that I will get no co-payment, or that my costs will be lower and I will not have to pay that amount of money? I allow them to compare and book and then go ahead and plan their hospitalization or outpatient service access. This is one thing that's really changed a lot for us. I was just telling one of the speakers here that the outpatient services in India are growing at about 100% every year in terms of just volume of transactions that we're handling. And we're making it cheaper and more efficient every time to go out there and discover the world of outpatient services. So just to tell you, a lot of this is run by technology. I have 1 minute. And a lot of it is run by technology. MediBuddy is the masterpiece. We have MediBuddy Pi, which is a reporting tool for the payer, for the insurer. We have MediBuddy Plus, which is a hospital tool or a provider tool that allows providers to submit, track claims, manage their receivables, and a reporting tool for the provider. We have MediBuddy as a web portal. We have MediBuddy as a cloud mobile-based app. We have MediBuddy Infinity, which is the marketplace services where we allow people to choose services. And last of all, we have MobiFit in the stack. And I call this the India stack because we've actually gone out there and changed every single piece of, we used to have millions and millions of paper that would come, sheets of paper that would come into the office. They've disappeared. And as a result of which, the India stack today has a fairly powerful representation in what we do. I think with that, I'll just say thank you very much. I think this is just some of the work that we do in India. Cover about 11% of the population. We're around the country, and it's honestly as a result of which this is the company that we've built. So 95% of our customers stay with us. They don't leave. We grow, and revenues about 20% year on year, and in terms of profits and margins, EBITDA margins about 30% year on year. So as a country that still deals in Indian rupees, and we make and we work and deliver services in rupees, I think we've learned to work with the India stack and the India population. But I think the relevance of this to other economies in the way they handle or they administer these transactions could be a very important and interesting conversation. Thank you so much.
Thank you, Vikram. Thank you very much.